Are you tired all the time, maybe feeling like you need to reach for that extra cup of coffee or lie down for a nap? Well, this is not really normal, but very common in midlife. And in today's video, I want to talk to you about some sneaky underlying reasons that you might be having all this fatigue. And I'm going to tell you the 4 important lab tests to ask your doctor to test for to make sure that you don't have an underlying medical issue going on. Hi, I'm Dr. Heather Modet, a functional and integrative medical doctor turned full-time wellness educator. And I saw many times in my practice over the last decade women in midlife coming in with complaints of fatigue. And yes, sometimes a lot of it had to do with the hormonal ups and downs of perimenopause and menopause and the sleep loss that was occurring at that time. But sometimes this was not the issue, and we were able to pinpoint some reasons with simple blood tests that can be found at any lab, really, that showed that there might have been deficiencies or problems with other hormones that were causing their fatigue. The first blood test is for vitamin B12. And vitamin B12 is a vitamin that we get from dietary sources, and it's generally very easy to get. And one of the issues, though, is that it comes really only from animal foods, such as meats, fish, dairy, and eggs. So people who have a vegetarian diet or a strict vegan diet often will have deficiencies in B12 because it's not generally stored in the body for long periods of time. It's what's called a water-soluble vitamin, not a fat-soluble vitamin. So we don't store it in our fat. And so it can easily get depleted over several weeks or months' time. Now, symptoms of B12 deficiency can range from feeling sleepy and foggy and fatigued to even having sort of muscle weakness and even numbness and tingling. And the reason is because B12 is really important for neurotransmitters in the brain, such as serotonin and dopamine production. It's also important to make myelin, which is the substance that wraps around the nerves of the central and peripheral nervous system. So people might get issues with neuropathy. And also it helps make red blood cells, which is one of the big reasons why people get fatigued. In fact, people with severe B12 deficiency will have very large red blood cells that are inefficient at carrying oxygen to our organs and tissues. However, if you eat a lot of B12 rich foods and you still have a B12 deficiency, it may be a problem of absorption. This is what happens. When we eat B12 rich foods, B12 gets activated in the stomach and then also gets absorbed in the small intestine. And there's several things that can go wrong there. For example, many people take medications that interfere with that activation of B12. Such things are proton pump inhibitors or H2 blockers. These are things that block acid production that a lot of people take for heartburn and ulcers and gastritis. And many people are on those drugs for years and years. And so over time, they don't absorb B12 as well. Now, also in the small intestine, people can have issues with inflammation, such as inflammatory bowel disease that can contribute to poor B12 absorption. Lastly, there's a rare autoimmune disease called pernicious anemia. And although this is rare, sometimes if someone has a B12 deficiency that can't be corrected, it's a good thing to look into. So what do you do if your doctor says that you have a B12 deficiency? Well, first of all, you want to look at the underlying cause, but you also can take B12 in vitamin form. But the thing is you really want to try to focus on taking what's called a sublingual vitamin. That way it bypasses the stomach and the intestinal tract and gets absorbed right through the mouth. Or you can get B12 injections. Most of my patients who've had B12 deficiencies in the past have corrected them with supplementation and feel so much better, usually within a matter of weeks. The second blood test to ask for from your doctor if you're feeling fatigued is a thyroid hormone panel. And when I say panel, I mean more than one test. And that's because a lot of times people get what's called a TSH or thyroid stimulating hormone done by their doctor as a screening test. And they are told that if it's within normal range, that everything is normal. And I will tell you that is often not the case. First of all, thyroid stimulating hormone does not come from your thyroid gland. It comes from your pituitary gland, and it tells your thyroid gland to pump out thyroid hormone. And thyroid hormone is so important for our metabolism. In fact, we have thyroid hormone receptors on almost every tissue in our body. That's how important it is. And thyroid hormone helps regulate our metabolism, which means basically it regulates the speed at which we are able to take our nutrients in our food and create energy out of that. They are involved in our mitochondria, which are the powerhouses of our cell, and helps them turn over. So if we have a lack of thyroid hormone, there's many reasons why we could feel very tired and sluggish, and it can contribute also to weight gain. The other thing is it can make us feel sort of sluggish and depressed too, because it can interfere with neurotransmitter production in the brain. Now, remember, I said panel, and that is because you want to get a thyroid stimulating hormone, and then also you want to measure the actual thyroid hormones themselves. And there's two. One is simply called T3, and one is called T4. Now, it's not really important to know much more except to the fact that if you look at those, you're going to have a pretty good idea about how your thyroid is functioning. Now, it's important to understand that over the age of 50, it's really, really common to get what's called subclinical hypothyroidism. And that means that our thyroid starts to not work as well. And this can be due to vitamin and mineral deficiencies and chronic stress and other reasons, but sometimes it is due to age and inflammation. And why this is important to understand is that many doctors look at the range of thyroid hormone and say everything looks fine, but we really want to try and optimize it. And so sometimes it's really important to talk to a doctor and maybe even see a specialist if your thyroid is even a little bit off. Sometimes thyroid issues can be due to inflammation and also to other vitamin deficiencies that support the thyroid glands. The most common form of low thyroid function, however, is an autoimmune disease called Hashimoto's disease. And that is something that can also be tested for through measuring anti-thyroid antibodies. Another test to ask for from your doctor if you're fatigued is a vitamin D level. Now, I've seen people with profound vitamin D deficiency who seem to have a normal diet, but it's important to understand that we actually get very little vitamin D from our diet. Most of the vitamin D that we create naturally in our body is from exposure to ultraviolet radiation, otherwise known as sunshine. But you need about 15 to 20 minutes of broad spectrum light every day in order to get adequate vitamin D throughout the whole year. And many of us live in places where it's cloudy, overcast, or have very short days, so we really don't get that sunlight. In addition, many of us work inside, and so we don't get that exposure, or we're wearing long sleeves and sunscreen. And so there's a profound problem with vitamin D deficiency throughout the world. Most of us know about how important vitamin D is to our immune system and also to our bone health. But a lot of us don't realize that vitamin D is extremely important for our mood and mental health and also to our energy, because vitamin D is really necessary for keeping our mitochondria healthy, which again are the powerhouses of the cell that help us make something called ATP, which literally runs our body. So when we have low vitamin D levels, we can feel profoundly fatigued and wanting to sleep all the time and maybe even a little depressed. Now, vitamin D is a fat-soluble vitamin. That means we actually do store it in our fat for longer periods of time. And it's extremely easy to replenish vitamin D. You really only have to take small amounts every day throughout the year, or maybe slightly higher amounts in the winter if you are found to be vitamin D deficient. Another thing to know also is that certain ethnic groups, especially people who have darker skin, do not absorb the ultraviolet radiation as readily, and they actually may be at higher risk for vitamin D deficiency. Lastly, we tend to use up a lot of vitamin D when we're under physical and mental stress, or if we're sick a lot, and that's because of its role with our immune system. And so if we're run down a lot, or we've been through a lot of stressful times, it's really important to make sure those vitamin D levels are healthy. The last test that I think is really important to evaluate if you have chronic fatigue or tiredness is ferritin. And ferritin is really just measuring your storage form of iron. You can measure serum iron as well, which is what is fluctuating or circulating throughout the body, but that is going to vary from day to day, whereas ferritin gives you a sense of what you have stored up. And sometimes you may get a complete blood count from your doctor and they may say, hey, everything looks great. You're not anemic. But if you look at a ferritin test and it's very low, that could be telling you that you really need to look into why you don't have enough stored iron in your body. Now, why do we get tired if we don't have enough iron? And it comes down to the fact that we use iron to help make hemoglobin, which is the molecule that carries oxygen throughout our body and delivers oxygen to all our tissues. And so if we have low iron, we tend to be very tired and brain fogged and sometimes confused and weak. And sometimes our muscles don't get enough oxygen. So we feel like even with mild exertion, we're very fatigued. And having low iron actually is quite common in perimenopause because women may have really heavy bleeding towards the end of perimenopause, or they may have fibroids in their uterus and have a lot of heavy bleeding. And this may not really be evaluated or treated. And so even postmenopausally, they have low iron. We get our iron from our diet. And we can get it actually both from animal and plant foods. But the type of iron that we get from animal foods is called heme iron. It's much easier to absorb. But we can still get non-heme iron from things like lentils and fortified grains and spinach and such. But non-heme iron is not as well absorbed, but you can augment it by eating iron-rich vegetables and other foods with vitamin C. But let's just say that you're eating all of those foods and you're not having any heavy bleeding. You want to look into whether or not you have some occult bleeding from another source. Now, this could be due to bleeding in the GI tract, maybe hemorrhoids, or something that needs to be evaluated by a doctor. The other thing is that certain medications, again, can prevent you from absorbing iron from your food. One of the most common is a diabetes medication called metformin, and then also the medications that I mentioned before, which are PPIs and H2 blockers, which lower the amount of acid we produce in our stomach, can also decrease the absorption of iron. Now, there are some people who need to take iron in addition to their regular daily diet, and it's very easy to take in different forms, but it's important to understand that some iron can be very constipating. I hope you found this video helpful. I'm going to put down in the description a cheat sheet about all the things that we talked about today. And also make sure to check out my newsletter below, which I send out bi-weekly, chock full of information about optimizing midlife health for women. Until next time, stay well.